everyone, my name is Courtney and I am a longtime therapist and clinical supervisor, community advocate, and a tad bit of a creative director. I've spent many years helping teens, kids, and grown-ups navigate big feelings with clarity, care, and creativity. This video is part of a trauma-sensitive series designed to make therapy feel safer, gentler, and more understandable, especially for people who might be curious, nervous, or unsure. Today we're talking about something a lot of people your age go through but don't always want to talk about, and that's starting therapy. If you're listening to this, you might be thinking about starting therapy, or maybe someone has suggested it to you, and you're trying to figure out how you feel about that. Here's the truth. Therapy isn't about being broken, sick, or crazy. There's nothing wrong with you. It's about having a space where you can talk honestly, get support, and understand yourself better. Let's walk together through what therapy actually looks like, how to prepare and what happens in your first session, how to deal with the anxiety of therapy, how your parents are involved, and what to do if you ever feel like quitting. Starting therapy can bring up a lot of uncomfortable stuff. Meeting a new adult, talking about personal stuff, not really knowing what to expect, and worrying if you'll be judged are all normal parts of starting therapy. People also feel like maybe they should already know or have everything figured out and feel uncomfortable about asking for help. Here's the thing, you don't have to perform, you don't have to be polished, you don't have to spill your whole life story on day one. Therapy is a process, not a test. In preparing for your first session, remember you don't need a script because you're not telling your whole story on day one, but a little prep can make things easier. You can start off by jotting down a few things you want help with or that you want to talk about, or any questions that you may have for your therapist. Bring a fidget or some sort of grounding object, something that makes you feel comfortable and safe. Wear something comfortable as well, and if you get nervous or unsure, speak up and tell your therapist. You don't need the right words, you just need to show up exactly as you are. The first session is really just about getting to know each other and setting the tone for the work that you'll continue to be doing together. Your therapist might ask you your name, preferred pronouns, and what brought you in, or what prompted you to start therapy. They'll explain confidentiality and its limits. They'll ask you what you specifically want help with and help you work on goals for therapy. They'll check in about your comfort level and talk about how therapy really works. You can ask questions too, like what is your approach? What if I don't want to talk about something yet? Can we slow down if I get overwhelmed? And what do you do if I don't know what to say? You're allowed to advocate for yourself. If you're under 18, parents or caregivers are usually part of the process in some way, but that does not mean they get to know everything you say in therapy. Most therapists typically will meet with your parent or caregiver briefly at the beginning. They'll ask about what they've noticed, and they'll talk about scheduling, they'll go over paperwork, and again, they'll talk about general goals for you in therapy. They'll check in with your parent or caregiver occasionally in kind of a big picture way. Therapists take confidentiality seriously, though, and that means they don't repeat everything you say. They don't give parents a play-by-play of every session, and they don't share personal details unless there's a safety reason. You get your own space. There are limits to confidentiality, so therapists must involve an adult or make a report if you are in immediate danger, if someone else is in danger, or there's some sort of abuse happening. They'll explain this clearly so you're not guessing. You do get a say, like you can always ask, what will you tell my parents? Can this part stay private? Or you can even ask if they will help you talk about these things that may need to be reported. A good therapist checks in with you before sharing anything. Therapy isn't one size fits all. There are many different styles or approaches to therapy, and most therapists work in different ways. Some common styles include talk based approaches, and this is about making sense of your experiences without the pressure to spill everything at once. We often imagine therapy as just sitting around and talking, so naming the purpose behind the talking helps it land. Conversation will go at your pace. You choose what you want to talk about and what you're not ready for. Reflection in these conversations helps you connect dots, helps you understand why certain situations hit hard, why your reactions actually make sense, and how past experiences can show up now in the present. Talk therapy also really focuses around understanding patterns, so noticing cycles in friendship, stress, school, or emotions so you can change what isn't working. Again, there's no forced storytelling. You don't have to give the details you don't want to share, and the focus is on how things affect you today. Skills based approaches is about building tools you can actually use outside the session, especially when your nervous system gets overwhelmed. So, you'll work on coping tools, which are ways to handle big feelings without shutting down or exploding. Grounding strategies are techniques that help you come back into the present when your mind or body feels out of control. Communication skills, so how to say what you need, set boundaries, or ask for support without feeling guilty or dramatic. And there'll also be a lot of planning for tough moments, so creating a menu of things that help when stress spikes. Skills based work may include a lot of other skills things like learning how to problem solve, make decisions, or even just working through anger management skills. Body based approaches work to help us understand that our body isn't betraying us, it's reacting to stress or past experiences. And this is often a huge relief. This is also known as somatic based therapy, and it really focuses on teaching you how to notice tension that's happening in your body. So, if your shoulders tighten, if your stomach starts to drop, or you feel sick to your stomach, if you clench your jaw, all these different signals that your body is trying to protect you from something that makes you feel unsafe or uncomfortable. Breath work is not just about breathing, but learning specific ways of breathing that help to calm your nervous system. Body based approaches also help you learn more about your nervous system cues. So, understanding the difference between being overwhelmed, being shut down, or activated so you know what your body needs. There's a lot of movement or sensory tools used in body based approaches as well. So, learning stretching, how to use fidgets or other sensory objects or grounding objects, learning about posture shifts that can help you feel steadier and safer. Creative approaches work on giving you nonverbal ways to express things that may feel too big, too confusing, or too hard to say out loud. So you might spend some time drawing or simply doodling. And it's not about being artistic, it's about expressing your feelings or your experiences visually. Writing may also be involved in creative approaches, so using journaling, creating lists, writing letters that you don't send, or using metaphors that help you describe what's going on. Metaphors themselves are about comparing your feelings to storm, about wearing armor or tangled headphones or things like that. Different ways to talk about the hard things indirectly, but honestly. And movement is also involved in creative approaches. And this may be gentle movement, pacing, or again, posture shifts that help you release tension or connect better with your body. Sometimes movement may even involve dancing. Now, trauma informed is not actually a type of therapy. There is such a thing as trauma therapy, but this is talking more about how therapists show up so that you feel safer, more in control, and less alone while you work through things that have been overwhelming, confusing, or painful. It's built around a few core ideas. First of one being that your reactions make sense. Even if they feel really intense, confusing, or too much, trauma informed therapists assume your feelings have reasons, not flaws. You also, again, get choices in trauma informed therapy about what you want to talk about, how fast you go, and what feels okay for your body and mind. It's an understanding that your nervous system matters. Therapy, again, isn't just about talking, it's noticing how your body reacts and learning ways to feel steadier. Again, you don't have to tell your whole story. Healing doesn't require reliving everything. Trauma informed therapy is also all about safety, and safety comes first: emotional safety, physical safety, and the safety of not being judged or pushed. Most therapists are trauma informed therapists, but that doesn't happen in every single case. And trauma informed therapy does feel different than quote unquote regular therapy because of the pacing. So instead of diving into the hardest stuff right away, the therapist checks in about what feels manageable and will make adjustments. There's a lot of collaboration in trauma informed therapy. You're not being treated, you're working with someone. You get to say, "This is too much. Can we slow down? Can we try something different?" As already mentioned, body awareness is a huge part of this. You're going to learn grounding, breathing, or movement strategies to help your body feel less on edge. Trauma-informed therapy, though, is also predictable. The therapist explains what they're doing and why, so nothing feels like a surprise. And there's a huge respect for boundaries with trauma-informed therapists. You choose what details you share, you can pause, you can take breaks, you can say no. Trauma informed therapy is also, though, understanding that a lot of the things that are happening to us in our present do come from our past, whether it is specific that it is trauma related or maybe just an event in our past that greatly affected us. So that is why things work a little slower with trauma informed therapists. Again, you do not have to tell your story and you don't have to talk about what happened. You can just talk about how things are affecting you now, like your sleep, trust issues, stress, school, relationships, without going into the details you're not ready for. If you feel like you're shutting down or getting overwhelmed in sessions, a trauma informed therapist expects that. They'll help you slow down, they'll help you ground yourself, or they'll switch gears. It's not a failure, it's just part of the process. And it's also an understanding that you may not remember everything clearly when you're talking in sessions. And this is normal. If you have experienced some sort of trauma or there's some major event that's happened in your life, it can affect your memory. So you don't need to have perfect details to heal. Trauma informed therapy is also helping you to hopefully not feel embarrassed or weird. It's understanding that your reactions are just basic human reactions. Nothing you feel is too weird for therapy. And if you don't trust people easily, typically again because of trauma or major events in our past, remember that you don't have to trust right away. Trust is built slowly, and you get to set the pace. It's important to remember, though, that regardless of the type of therapy, it's not about fixing you. It's about understanding what happened to you and what you were going through. It's not about being strong enough. It's about having support while your nervous system recalibrates. And it's not about reliving pain. It's about building safety, skills, and connections so you can move forward. We often think that when we're going to therapy, we have to pick one approach or the other. But trauma informed treatment blends them all together depending on what feels safe and helpful that day. So, again, most therapists are trauma informed, so you'll see a combination of all these different approaches. A session might start with talking and then shift into grounding skills, then use a metaphor to help you better explain a reaction. Another day might be mostly body based because your nervous system is overwhelmed. Some weeks you might want practical skills, and others you may just need space to reflect. Honestly, there is no one right way to heal. Therapy adapts to you, not the other way around. If something doesn't feel like your style, You can say so. Therapy should feel like a collaboration, not a performance. Beyond talking about different styles, it's also really important that we talk about the good fit with a therapist and what a good therapist does. So, a good therapist listens to you without judging. They respect your boundaries and don't push you too fast. They explain things clearly in ways that you can understand. They check in about how you're feeling and they help you understand your emotions and your thoughts and your behaviors. They collaborate with you instead of talking at you. You don't need an instant comfort with your therapist, but you should at least feel respected, listened to, and not judged, safe enough to be honest, and like you can breathe in the room even if you're feeling uncomfortable. If something feels off, you can bring it up either to your therapist directly or to another trusted adult and allow them to help you talk to the therapist. Most good therapists are going to work with you to help you feel comfortable and heard in your therapy sessions. If it continues to not feel right after a few sessions, though, it is okay to talk to someone about switching therapists. Therapy should feel supported, not stressful, and you deserve a good fit with your therapist. Boundaries are also really important when you're developing a relationship with your therapist. And a lot of teens wonder specifically about what's allowed. So here's what's normal. You don't have to, again, answer every question. You can say, I don't want to talk about that yet. You don't have to protect your therapist's feelings. You can ask for breaks, structure, or slower paced. And remember that therapists can be warm and caring, but they're not your friend. They are your support person. Boundaries help therapy feel safe. Boundaries also exist in understanding that your identity matters in therapy, all of it. You can talk about culture, race, gender, sexuality, neurodivergence, religion, family dynamics, whatever. If you ever feel misunderstood or stereotyped, you can say so. Therapy should be a place where your whole self is welcome. Boundaries also exist around communication and the use of tech in therapy sessions, and teens often wonder about these rules. So talk to your therapist and ask them, can I text you between sessions? What happens if I email you? What do you write in your notes? What can my parents see in the portal or in your notes? Different therapists have different policies, and you deserve to know how communication works. Feeling anxious before or during therapy is extremely common, whether it's your very first session or you're a few sessions in. Before the session, take some time to take slow breaths. Listen to grounding music, anything that helps to calm and relax you. And remind yourself, I don't have to be perfect, I just have to be honest. If you start to feel anxious or nervous during the session, ask for a pause. Hold your grounding object or say, I need a second. Tell your therapist if something feels too intense. After the session, it is really important that you continue to take care of yourself. So take a few minutes to decompress. Journal, draw, take a walk, do something comforting and relaxing. Your nervous system is part of the therapy process. Treat it gently. Therapy isn't only for big problems, so there is a difference between crisis support and everyday support. Crisis support are those things that require safety, stabilization, or urgent help. Everyday support focuses around stress, identity, relationships, school pressure, those just everyday kind of problems that you might be running into. You can talk about intense feelings without fear of being overreacted to, and therapists are trained to help you sort through what's urgent and what's just heavy. Remember, though, that sometimes therapists are not available in a crisis situation. So, in that case, the therapist will also explain to you what you can do to contact them or a crisis support line if they are unavailable. Therapy works best when it connects to your real life. It's important that you continue to practice skills in between sessions. If you're only doing the work when you're with the therapist, it's not going to be helping you much when you're in school. Take notes or voice memos during therapy or immediately after so you remember what you talked about and any of the skills that you maybe worked on. Work on noticing patterns on your own outside of the therapy room and then apply the skills that you've learned to them. Bring real life moments back into your therapy session so that you and your therapist can process together what went well or what didn't go well. And you can ask for homework or, again, things that you can do to practice what you learned in therapy or no homework. Therapy is a tool, not just a weekly appointment. It's really common to want to quit therapy out of nowhere, especially after a vulnerable session. Some reasons why people want to quit might be feeling embarrassed about something that happened in session, or maybe even feeling embarrassed about going to therapy in general, because there can be a lot of stigma related to going to therapy. Sometimes people may feel like therapy isn't working fast enough for them. They may not know what to talk about or might be feeling overwhelmed. They also may want to avoid working on those big feelings or talking about those big feelings. And sometimes maybe they're just feeling like they're too much. These reactions don't mean therapy is wrong for you or it's not necessarily working. It means that you're human. If you do have that urge to quit therapy, instead of ghosting your therapist, tell them that you're unsure. Ask them to slow the pace or ask for more structure. Talk openly if things are feeling heavy and let them know in between sessions how you were feeling. And talk about that urge to quit so you can work on it together. If you truly do need a break from therapy, though, that is okay. But again, don't just disappear. Have a closing session. Talk about what helped and what didn't, and make a plan for what's next outside of therapy, including what you can do if you decide that you want to come back to therapy. Closure helps your brain make sense of the experience. If you are having thoughts about wanting to quit therapy, grounding skills can really help with that. Here are some steps that are useful. Step 1, simply notice the feeling. Say quietly to yourself, I'm uncomfortable and that's okay, or whatever it is that you may be feeling in regards to therapy. Step 2, put a hand on your chest or your stomach and just notice your breath and feel it moving as you breathe in and out. Step 3, take a slower breath. Breathe in through your nose for 4 and breathe out of your mouth for 6. And you may want to do this a couple times. Step 4, look around the room and name 3 things you can see, 2 things you can touch, and 1 thing you're proud of yourself for. Step 5, remind yourself that you can go at your own pace and that you don't have to do this alone. Ending therapy is part of therapy. A healthy ending includes talking about why you're ready to end therapy, reviewing what you've learned, planning for your future, and knowing again that you can come back later. Most of the time, your therapist will talk about this before you ever get to the point of ending so that you're prepared for it and it's not going to come as a surprise. This is known as discharge planning. But again, you should always make sure that you have that ending session to have these healthy endings so that you have that clear closure in your mind. Starting therapy is a big deal and a brave one. You deserve support, understanding, and a space where you can be real. If you're beginning therapy soon, I hope this helps you feel more prepared and less alone or uncomfortable. You're doing something powerful for yourself, and you deserve every bit of support along the way.